The partnership between the government of the People's Republic of China and Uganda is more than just diplomatic ties. From cutting-edge medical technology to grassroots health initiatives, China and Uganda cooperation is not only building hospitals and training professionals, but is also bringing hope to millions of Ugandans. Join us as we explore the stories of those on the front lines. This is the story of China-Uganda cooperation in health, a story of resilience, innovation, and a shared vision for a healthier future.
China-Uganda Friendship Hospital is a hospital that was built and sponsored by the People's Republic of China and handed over to the government of the Republic of Uganda in 2012 as a gift of friendship.
Initially, KCCA wanted to continue running the hospital, but because of the status of the hospital being a regional referral, it was taken up by the Ministry of Health.
China-Uganda Friendship Hospital Naguru is a public facility, so the patient is worked on for free. The costs are made by government of Uganda.
Dr. Tugaineyo says that the friendship never stopped at the handing over of the hospital to the government of Uganda.
This friendship is ongoing. Every calendar year, we receive a team of Chinese specialists.
Medical teams has been in Uganda since the year 1983. And so far, around 23 batches of doctors have been dispatched to Uganda. And this have served the local community quite well. There are about 270,000 patients who have received treatment from these Chinese doctors. Also, these doctors frequently go to the local community to provide a free service to the local people, and they are warmly welcomed in Uganda.
Chinese medical team have treated more than 150,000 patients, performed more than 4,000 surgeries, rescued more than 600 critically ill patients, and also treated more than 400,000 patients with traditional Chinese medicine like acupuncture and moxibustion.
我是第23批中国医疗队的队长唐化，那么我是带领第23批共9名队员。 来到中乌友好医院执行这个医疗任务。
Acupuncture is a method of treatment used by the Chinese people.
That has been quite helpful because sometimes some of the patients were managed with conventional, what I would call Western medicine, sometimes reach a point where they are not getting the degree of relief you want. So we have referred quite a number of patients to them with good reports of response.
But at least I've learned. They leave me alone, I can handle. Because most of the cases I know how to handle, how to diagnose them. Because majorly, stroke, back pain, so I know the actual point and I know where to put the needles. Even if my supervisor is not there, me myself personally, I can do that. You have to know the actual point. When you put here, it treats this one. When you have cough, it treats this one. And the gauges of the needle we are using. Yeah.
The hospital has a bed capacity of 100 beds, as its mandate is stipulated in the National Hospital Policy of 2006. But doctors are overwhelmed by the number of patients they receive on a daily basis.
We accommodate far more than that because the hinterland that we serve is quite very populated.
Dr. Albert says the hospital cares for different specialized services.
Being a referral hospital, we offer specialized care in the areas of pediatrics that deals with children and adolescents. We offer specialized care for adults and adult medicine. We also have specialized care for women, obstetrics and gynecology. We also offer specialized surgical services.
And of course, we have also some other special units. Like we have a dental, we have ophthalmology, which is for eyes.
The hospital has got the soaring number of outpatients who turn up to get medical services.
The only challenge is that the hospital has become small because of the increasing number of patients who turn up.
The government of China has the intention of expanding and renovating this hospital. 12 years is quite a long time in terms of infrastructure and in terms of equipment.
With the friendship of China-Uganda, many staff at Naguru have got a chance to travel to China to acquire more skills in their profession.
TB, I was a little bit nervous. You know, it was the first time. I was like, oh, my first time. I got scared. I remember checking, remove days. I was like, what is this?
I went there in 2017. Of course, when we were there in China, they took us into different hospitals. Their hospitals are quite big. They're huge hospitals. You find a hospital maybe which has a bed capacity of maybe 1,000 or 500 or 700 bed capacities. For us, we are talking about 100 bed capacity.
What we learned there, they are actually a step ahead. Their maternal mortality rate is very low, and we looked at the reasons why it's low. It's the kind of care and technology they use there, and we were able to learn a few, and the few we learned, we are trying our best to incorporate it here, though with the technology it's kind of hard.
Dr. Emmanuel Tugaineyo, Director of China-Uganda Friendship Hospital in Naguru, has expressed his gratitude towards China.
I would like to express my gratitude to the Chinese community that resides here, by the way, and their friendship and their help, because they support us. Apart from manpower, they also bring things on board. Sometimes they come with equipment, they bring some medical sundries to supplement what we have and what we get from national medical stores. Government of China has promised to give us a hand in that. But first and foremost, I think what we also need is to have land to expand the hospital. Land is very crucial, and the Ministry of Health officials are handling that with the powers that be to make sure that we obtain land where the expansion of this hospital can take place. I appreciate them and pray that they will bring to pass their promise of expanding the hospital, renovating and re-equipping the hospital, as we envisage this hospital becoming a national trauma center.
The government of the People's Republic of China has continued to support Uganda's medical sector in building capacity and resources, most recently in the fight against malaria. The support China gave Uganda during COVID-19 pandemic cannot be overemphasized. As the cooperation stays put, the two countries will not eschew the fruits of their friendship. On Gulu Highway, 10 kilometers away from the Karuma Hydropower project, is the Chunyi General Hospital, the best hospital in Oyam district, constructed by the Sino Hydro Company.
Only health center 3 in Kamdini sub-county. The nearest health center is like 8 kilometers. Before this place was established, the community of this area, they used to move to those health center 2s, and others were even unable to move, so they could rely on the small drug shops around this area.
This hospital made his life for me because it is somehow not far and we have enough service.
Yes, so my wife is pregnant from my first child. I bring my wife here for maternity. I'm so happy to get medicine from here. We was moved here up to Atapara Hospital, 7 kilometers from here up to there. So from North Center up to here is just 1 kilometer. So I says here is helping us from here.
This facility, equipped with various departments and adequate accommodation for medical staff, serves as a cornerstone of improved healthcare services in the region.
Around 792 outpatients for the month of March. Even in antenatal, we managed to get 103 mothers that attended antenatal from here. And we also have some other services we're offering, like maternal that is deliveries, where we managed to admit 14 mothers, and out of 14, the 11 delivered normally without any problem. And we managed to get 12 babies because one mother gave birth to twins.